वेलकम टू RRB NEXUS। इन आवर रैंडम क्वेश्चन एंड आंसर सेशन हमारा प्राइमरी गोल है कि आपकी परीक्षा से पहले हम सभी सवालों का कवर करें जो कि परीक्षा में सबसे ज्यादा संभावित हैं। और ये सवाल पिछले वर्षों के नॉर्सेट, AIIMS, RRB, ESI, PGIMR की परीक्षाओं के प्रश्नों पर आधारित हैं। Join us regularly to make sure your selection.
The nurse is teaching the client about key medication information for taking cyclosporin after renal transplantation. Which of the following should the client be especially alert for? A. Signs of infection. B. Hypotension. C. GI disturbances. D. Hair loss.
And the answer is option A. 1. Signs of infection. After a kidney transplant, the body's immune system is weakened to prevent rejection of the new kidney. Cyclosporin is a medication that further suppresses the immune system to keep it from attacking the transplanted kidney. While this helps prevent rejection, it also makes the body more vulnerable to infections. The client needs to watch out for any signs of infection, such as fever, chills, cough, sore throat, or any unusual discharge from wounds, and report them to the doctor immediately. 2. Hypotension, low blood pressure. Hypotension is not specifically associated with cyclosporin, but it can occur hypertension a side effect of other medications or from the body's response to the transplant surgery. While it's important to monitor blood pressure regularly, it's not the main concern when taking cyclosporin. 3. GI disturbances, gastrointestinal problems. Some people may experience stomach upset, diarrhea, or nausea while taking cyclosporin. While these side effects can be bothersome, they are generally not life-threatening or the primary concern after a kidney transplant. 4. Hair loss. Hair growth is a possible side effect of cyclosporin, but it's not as critical as other potential complications. Hair growth can be distressing, but it's not a significant risk to the client's health or the functioning of the transplanted kidney. Brief explanation of cyclosporin. Cyclosporin is a powerful immunosuppressant medication commonly used after organ transplantations, including kidney transplants. It works by suppressing the immune system's response to prevent it from attacking and rejecting the transplanted organ. While it's an essential medication to maintain the health of the transplanted kidney, it also increases the risk of infections.
Which of the following is the primary cause of abdominal ascites in a patient with cirrhosis of the liver? A. Increased vasopressin level. B. Increased serum sodium level. C. Decreased serum aldosterone level. D. Decreased serum albumin level.
And the answer is option D. The term ascites is derived from the Greek word ascos, which means bag or sac. In the context of medicine, ascites refers to the accumulation of fluid within the peritoneal cavity, which is the space between the abdominal organs and the abdominal wall. The term cirrhosis originates from the Greek word kyros, meaning tawny or orange-yellow. Cirrhosis is a condition in which the liver undergoes significant scarring and fibrosis due to chronic injury or damage. As the disease progresses, the liver tissue becomes nodular and hard, and its color may change to a yellowish. Explanation. Ascites is the abnormal accumulation of fluid in the abdomen. Cirrhosis is a liver disease characterized by scarring and impaired liver function. The primary cause of ascites in cirrhosis is a decreased serum albumin level. Serum albumin is a liver-produced protein that helps maintain fluid balance. Liver dysfunction in cirrhosis leads to reduced albumin synthesis. This decrease in serum albumin results in fluid accumulation in the abdominal cavity, leading to ascites. Asterisk correct answer asterisk. D. A decreased serum albumin level.
A client with status asthmaticus is in severe respiratory distress. The nurse should maintain the client in which position? A. Sitting upright. B. Supine. C. Side lying. D. Prone.
And the answer is option A. Status asthmaticus is a medical term used to describe a severe and prolonged asthma attack. Asthma is a condition where a person's airways become swollen and narrow, making it difficult to breathe. It is a life-threatening emergency that needs immediate medical attention. Sitting upright is the best position during status asthmaticus. Sitting upright helps open up the airways and aids in easier breathing. Gravity assists in expanding the lungs, making it beneficial during an asthma attack. Lying flat on the back, supine, side lying, and lying on the stomach, prone, are not recommended positions during a severe asthma attack. These positions can worsen breathing difficulties and restrict lung expansion. The correct answer is option A, sitting upright.
Which of the following is the most likely systemic adverse effects of combination chemotherapy for the treatment of metastatic carcinoma? A. Ascites. B. Nystagmus. C. Leukopenia. D. Polycythemia.
And the answer is option C. As a good teacher, I'll explain each option briefly. A. Ascites. Ascites is the buildup of fluid in the abdominal cavity. It is not a common side effect of combination chemotherapy for metastatic carcinoma. B. Nystagmus. Nystagmus is a condition where the eyes make repetitive, uncontrolled movements. This side effect is not typically associated with combination chemotherapy for metastatic carcinoma. C. Leukopenia. Leukopenia is a reduction in the number of white blood cells. Chemotherapy can affect bone marrow, leading to a decrease in white blood cells, which can weaken the immune system. D. Polycythemia. Polycythemia is an increased level of red blood cells. It is not a usual side effect of combination chemotherapy for metastatic carcinoma. Adverse effects of combination chemotherapy: nausea and vomiting, fatigue, hair loss, leukopenia, anemia, thrombocytopenia, diarrhea or constipation, mouth sores, neurological effects, skin and nail changes.
In hemophilia, the bleeding is due to the deficiency of which factor? A. Factor 6. B. Factor 7. C. Factor 8. D. Factor 9.
And the answer is option C. The term hemophilia comes from two Greek words, hema meaning blood, and philia meaning a tendency or affection towards something. So, hemophilia literally means a tendency towards bleeding. Hemophilia is an inherited bleeding disorder, and people with this condition have a reduced ability to form blood clots. C. Factor 8. This is the correct answer. Hemophilia is caused by a deficiency of factor 8, which is a crucial protein in the blood clotting process. Without enough factor 8, the blood cannot clot properly, leading to excessive bleeding even from minor injuries. D. Factor 9. Factor 9 deficiency causes a different type of hemophilia called hemophilia B or Christmas disease. While it is related to bleeding disorders.
Which organ system regulates the electrolyte balance in the body? A. Kidneys. B. Heart. C. Parathyroid. D. Liver.
And the answer is option A. Kidneys. The kidneys play a crucial role in maintaining the body's electrolyte balance. They filter the blood and help remove excess electrolytes, such as sodium, potassium, and chloride, while also reabsorbing the necessary amounts to keep the balance in check. B. Heart. While the heart is responsible for pumping blood throughout the body, it does not directly regulate electrolyte balance. C. Parathyroid. The parathyroid glands are involved in regulating calcium levels in the body, but they do not directly control electrolyte balance. D. Liver. The liver has various functions, such as detoxification and metabolism, but it does not play a direct role in regulating electrolyte balance. In summary, the correct answer is A. Kidneys, as they actively control and maintain the body's electrolyte balance by filtering and reabsorbing electrolytes as needed.
And for additional query, search on YouTube RK Edu Nexus, and get brief note on topics, join our Telegram channel, same name RK Edu Nexus.